Good morning again. And you did come back. Thank you. On behalf of the Board of Governors and staff of the NLN, welcome to the National Faculty Meeting. What an exciting morning this has been with Dr. Malone's exhilarating CEO address and our celebrations of so many deserving students, faculties, and schools of nursing. Tremendous job. And now we have another much anticipated event where we come together as a nurse faculty to discuss issues at the heart of our work, to bring excellence to nursing education, and to build a strong and diverse nursing workforce to advance the nation's health, and we must never forget that. I have seen all of you over the past few days proudly wearing your buttons. Yes, we all advance the health of the nation through our work as nurse educators. Before we begin the National Faculty Meeting, I have the very special honor to bestow the NLN's President's Award for Reshaping Nursing Education to Amy Berman. Amy Berman is currently a Senior Program Officer at the John A. Hartford Foundation, located in New York City. With the Hartford Foundation since 2006, Amy heads the Foundation's Integrating and Improving Services portfolio, focusing on the development and dissemination of innovative, cost-effective models of care that improve health outcomes for older adults. Founded in 1929, the Hartford Foundation's overall goal is to improve the health of older adults by creating a more skilled workforce and a better designed healthcare system. Today, the Foundation is America's leading philanthropy is leading America's philanthropy with a sustained interest in aging and health, and they've been there for many years. Amy lives the Hartford Foundation mission. While a nursing student at NYU just 10 years ago, Amy served as Nursing Education Initiatives Director for the Hartford Institute for Geriatric Nursing at New York University College of Nursing. There, she conducted a national survey on gerontological nursing, that content being located in baccalaureate programs. Her findings were cited in the Institute on Medicine's report, Retooling for an Aging America, Building the Healthcare Workforce. In 2007, Amy led an initiative at the Hartford Foundation to extend Hartford funding to all pre-licensure nursing programs and was the driving force behind the collaboration between the NLN and Community College of Philadelphia that produced the NLN's Advancing Care Excellence for Seniors project, known nationally as the ACES Initiative. Additionally, funded by that Independence Foundation of Philadelphia, Laerdal Medical, and the Hearst Foundation, the national project has spearheaded the use of teaching strategies and unfolding cases to help make care of older adults an integral part of nursing curriculum nationally. After all, we all know and love Millie and Red and Eartha and Julia. They're now part of our tradition. If you don't know them, go find them. Amy has been our ACES cheerleader, recognizing that how we teach care of older adults will ultimately influence how older adults are treated and valued by nurses in diverse healthcare settings. Beside her BSN from New York University College of Nursing, Amy also has a Bachelor of Science in Healthcare Administration from the University of Massachusetts Amherst. For her tireless efforts to raise our consciousness to see the world of nursing education from a new lens, to embrace innovative and futuristic practices that improve the care of older adults, and to reshape nursing education to make older adults an integral part and a valued part of our curricula nationally. And on behalf of all 35,000 NLN members, many of whom provide care daily for our seniors, I'm honored to bestow this prestigious award on an absolutely fantastic human being, Amy Berman.
I just wanted to say a very sincere thank you to the National League for Nursing, to all the nurse faculty who are here, who are dedicating their time to improving the health of our nation through the preparation of students. We know that the numbers of older adults are going to double in very, very short time, and the work that you're doing to help prepare these students to provide care at the bedside for complex older adults, the people who cycle in and out of the healthcare system, is going to be of immeasurable help to our nation. On a personal level, you should know that I'm going to share that I myself have a terminal cancer diagnosis, and I myself live the life of the materials that you're teaching. I focus on function. I focus on care coordination. I do all of the things that you're all learning about through the ACEs work. It's incredibly important to the nation. Chronic disease, end-of-life issues, these will become more and more prominent in the care that we give. On behalf of the John A. Hartford Foundation, I thank you all. I thank Community College of Philadelphia, the Laerdal Medical Corporation, and I also thank the Hearst Foundation for their recent contributions to this effort. What you're doing is incredibly important. Thank you again.
It is now my distinct pleasure to introduce our president-elect and my colleague, Dr. Judith Halstead, to, in the NLN tradition, to chair the 2011 National Faculty Meeting. Dr. Halstead.
Is that the, take our places? Yeah. Here we go. Okay. Good morning.
Good morning.
And thank you so much for joining us here today at the National Faculty Meeting for 2011. As you have heard throughout this summit, beginning with Dr. Shalala's comments on Wednesday and our panel presenters yesterday, this is an exciting time for nursing and nursing education here in the United States. A time when nursing is at the forefront of many, many discussions on health care and all about workforce development and healthcare reform. The findings from the Institute of Medicine report on the future of nursing have been at the front and center in our discussions here at the summit, and we have been continually reminded of the need that we have to transform nursing education. As you also know, the mission of the National League for Nursing is to promote nursing education excellence so that we build a strong and diverse workforce to advance the health of the nation. So in keeping with our mission, the National League for Nursing has initiated a series of discussions around post-baccalaureate education here in the United States, most recently convening a roundtable of leading nurse educators from 16 schools of nursing and publishing a vision statement on post-baccalaureate education that reaffirms that the MSN education remains a valid and valued means of preparing nurses for advanced nursing practice. Now, the National League for Nursing intends to continue to fully explicate this vision that we have for post-baccalaureate education, and doing this by developing indicators of excellence for post-baccalaureate education that integrate NLN's model, education competency model. So today, what we would like to do during this time period is once again hear from you. This is your time. We do have about 20 minutes this morning to discuss this topic so that we can listen to your comments and concerns. And our president, Kathy Schultz, and our CEO, Bev Malone, join me here on the stage to listen to your comments, your concerns, questions you have, but most importantly, this is time for us to dialogue with each other, for you to talk with each other as well. So if you would begin to line up at the mics, we'll be ready to start the dialogue. But to get this started, I want to pose, first of all, just a couple of questions for you to consider. Many nursing faculty in schools right now are, we know, talking about or trying to make decisions about what types of post-baccalaureate education to offer in their schools. And as you position your programs for the future, I know you're having those conversations. What types of data are you using to make those decisions, or that you would like to have to help you make those decisions? And what types of factors are influencing the decisions that you're making about post-baccalaureate education in your schools and your programs? And another important question that we need to consider, and you know this conference theme is academic progression, leading academic progression. Regardless of the type of program we currently teach in, we are preparing our students not only to get that initial degree, but also to prepare themselves for hopefully graduate education. So what types of academic progression models do you think would be most effective in building a diverse nursing workforce of advanced practice nurses? Those are just a couple of questions to again get us started, but we'll start anywhere you would like to start. And as people begin to move to the mic, I'm going to turn first here to Kathy and Bev and ask them to offer a few thoughts on those questions in this topic.
Start with Kathy.
Kathy.
Thank you. Appreciate that. I think, to me, one of the most important things that we do in our work is orchestrating what we do with both the public's needs, and we've done that, I think, very well during this summit. I don't think anybody will be going away from here with any doubt that whatever we do is for advancing the nation's health. But I think also we've done some phenomenal work in the past that needs to be built upon. And one of the items, and you heard Judy mention this, but one of the items that we'll be building upon is the outcomes competencies model, which specifically addresses all levels of nursing education, but focusing that within the graduate education so that we expand that more than the current publication that's out there. And for those who may be novices to this, that's available on our website. Yep.
Well, you know, I'd like to address the one about types of academic progression. For me, I spent about 10 years in North Carolina, and I know that there was always a goal for us to come up with a curriculum, a sort of a standardized core kind of curriculum, and that could be spread out across the state. And my understanding is that we're getting rather close to that in North Carolina now, and that the work at Western Carolina and one of the community colleges led by Polly Johnson in terms of academic progression about, you know, enrolling in the community college program and automatically being enrolled in the baccalaureate program. I think that's pretty exciting. I think that cuts out a lot of the hemming and hawing and about whether or not you're going to move on. The data show that we as nurses tend to go back to school only one time. I mean, there are those of us in this room who are junkies in terms of school. I mean, we are totally addicted. I'm not talking about us. I'm talking about the majority of the 3 million nurses out there. We tend only to go back to school one time. So my thought is that when you do that one time, you should get the biggest bang for your buck possible. That's really important. And I would hope also that we would consider those RN to master programs, because it's so important, once again, once you get your family arranged, get your spouse or your partner situated, and then your children, it's almost necessary that you go and get as much as you can while you're going. So I'm for those that will get us there as quickly as possible, that will offer the easiest access for that next degree, the most we can do that one time that we move back into the system. That's what I would look at.
Okay, thank you. And I see that we have somebody at the microphone here, and I'll ask individuals to please state their name and where they're from as they begin to speak. Thank you.
All right, I'm Stephen Patton. I'm president of the National Association of Clinical Nurse Specialists.
Yes.
Okay, I am Stephen Patton. I am president of the National Association of Clinical Nurse Specialists, and I have a couple questions and comments. The first thing is that I would ask that everybody keep in mind the consensus model when looking at advanced practice nurses, especially for the clinical nurse specialist. With advanced practice consensus model, we're looking at role and population, and many schools are not including that population at this point, so you have to look at that. The second thing is that I was at the AONE conference and talked to many nurse executives, and all of them came up to me and said, where can I find a clinical nurse specialist? They are hard to find out there. And I said, talk to your schools and colleges, because they're the ones that are going to produce them. So I'd ask that you keep in mind that the number of schools offering clinical nurse specialists has declined over the years, but there still seems to be a demand for them. And if your institutions are looking to go magnet, clinical nurse specialists are what going to help you get there. So that's my comments. Thank you.
Okay, and Steph, I think Kathy, you had a comment?
Yes, Stephen, thank you for that. And I just want to say, having come through, and I'm prepared both as a CNS and an FNP, because back in the day they couldn't figure out which one was really going to have the avenue of what we now call advanced practice. But I truly do recognize the value of the CNS, and that was part and parcel of our discussion as those outcomes and competencies were developed. So please be reassured that we have thought about that, and that NLN's values of inclusivity include that preparation level.
And we know that, and we appreciate it. Thank you very much.
Yeah, thank you. Let's see, which mic is...
Janice,
okay,
first.
First one, please. Yes.
Good morning. My name is Clarice Otley, and I'm a faculty at Shepherd University in Shepherdstown, West Virginia, and also a protege of NLN Johnson & Johnson Leadership and Mentoring Program. And I've heard already this morning the need to build upon work that we are already doing through NLN. And my question stems around the fact that we want to get more faculty, because we need them as some of the faculty exit. And I've heard Institute of Medicine, NLN, Johnson & Johnson, they've all identified this as being an urgent need to have those nurses in place as faculty. And we need to have them there, but we also need to mentor them. And we've talked about it, and we've written about it, we've presented it at our conferences. And as Dr. Malone so eloquently stated today in her CEO address, that leadership initiates transformation. You know, my question is, what are we really going to do to actually operationalize leadership through effective mentoring of our faculty?
Okay, thank you for that question. Bev?
Well, you know, one of the things you start with is in this room, there should be a good 500, maybe less. Maybe we'd only say 300 mentors and another 1,700 proteges. So my question is, do we use where we are? Do we sort of understand the gold mine that we have before us? Because I'm not sure that we take advantage, and I think I'm guilty of this too, take advantage of knowing how much access we have to one another in at the NLN summit like this. There are, as you know, we've given presidential awards to some of the most outstanding nurse educators in the world as far as I'm concerned. And so you have your Billy Brown, you have all of the wonderful nurse leaders who come through. I don't know how many of us are knocking on their door saying, I would like to be mentored. And if you can't do it, could you recommend somebody who might? Or is there somebody in this room, with all those who are willing to mentor me, just raise your hand because I'm coming. It's that kind of, to be mentored, there has to be a desire on the mentee part. It's not all the mentor. And so it's a mutual interactive kind of process. And I think that we need to be more aggressive as potential mentees to say, this is what I want, this is who I am, and that we're not looking for just one mentor. I think that we get really confused about that. All you need is one mentor. No, 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 no. If you look at yourself, you say, well, I'm missing in global work, so I need somebody who understands global. So that may be a colleague, Jane, what's Jane's last name?
Sumner.
Jane Sumner, who is on our board and chairs the INESA group. So that may be a Jane Sumner, or it might be our president, Kathy Schultz, because she sends students over to all parts of the world on a regular basis. We need to start saying it's more than just one. I need my global here. I need my psychiatric mental health here because I need interpersonal relationships. I need somebody who understands politics here. You never have to get it in just one place. So be assertive. Somebody said we skip over assertive to aggressive. Maybe, but just be something. Do it. You know, just start moving it and saying, this is who I am, and I want to go there, and to get there, I need this and this. I need somebody who knows this, somebody who knows that. Anybody willing to mentor me? Look for it. You know, and if you come up and ask me, I'll just tell you I got 500 already. And, but it's not that I won't talk to you. It's not that you can't email me, and I don't want 2,000 people emailing me, please. My computer is so tired. But we need to go after it. So.
And I would just add to that, in addition to what Bev has said, is that those of us who have been doing this for many years do have the responsibility, I think, to look around us and identify those who may be a little hesitant right now to reach out and say, I need mentoring or I want mentoring, but you see the leadership potential, you know it's there, and then the more that we can reach out and begin to help develop, and that succession planning is something that we so desperately need in all of our organizations at this time. So it's not only what we can do as an organization, which we have a lot of plans, but also what we can do as individuals in our schools to continue to develop our faculty at whatever stage of the career they are in.
Just say something too.
Yes, and Kathy.
One other thing, then I would add to this, I call it the tap on the shoulder phenomena. When somebody says to you, have you ever thought about, or why don't you do, you fill in the blank, folks, they're not having just a social conversation. They have recognized something in you that says, oh, I think you can do this. So you've got to be receptive to that type of conversation. So I just wanted to bring that to your awareness.
Good point. Yeah. Okay, we'll go back to the second microphone where Janice is standing. Yes, please.
My name is Versie Johnson Mallard, and I'm at the University of South Florida in Tampa. And our university is a very progressive university in the sense that we have a DNP program that's a postmaster's program at this point. And I hear Dr. Malone speak of the importance of that seamless progression within our students or future practitioners. And that one-time Big Bang theory. So, with that said, I envision our RNs, our generic students coming in and moving, and once they come in, they are actually targeted for the RN to DNP. They start, a model that we're all familiar with would be the pharmacy program, where you come in as a pharmacy student, you leave as a doctorate in that area. At University of South Florida, when our students come in and they say that they want to focus as their major is an RN, but by the time they get to their junior year, they're still competing with everybody else to get into that last 2 years. I think that's broken somehow, and I would like to fix that, but again, we are a Research One intensive university, so the monies and the focus is NIH funding. How could you provide me with some guidance as to how I could move a vision to an innovation based on our new centers? I just need some help with that. Do you even think it's a realistic kind of move?
Yes. Academic progression.
You want to go first, Kat?
Just recognizing that there are bumps along the way when academic progression is initiated and worked through. And as a practicing dean, I really would suggest that it is very important, whatever degrees you offer and encourage students toward, that quality and healthcare outcomes are part of that movement, and encouraging students to know that. But they will need a lot of encouragement and coaching along the way, because the method by which they're arriving at those end degrees are not what is the norm in America at this moment. So in many ways, they're pioneers as nursing students. And I would hope that there are some faculty development activities internally that specifically target what your faculty needs to help shape and develop the students and teach them to where they need to be.
Versi, we have a sort of mechanism in the NLN for crunchy issues, where we pull together a small group to deal with it very quickly, and it's amazing. You know, one of the issues I hear you saying is, I've got to fix it. Can I fix it? I'm so glad it's not just us. Get you a little group together, so it's not just on Versi's shoulders, but it's about the creativity and brilliance of your colleagues and that interplay, and solutions will come up that you never thought about. And also get some people who are known for being obstacles involved in it. You know, you always need at least one good obstacle in a good problem-solving committee, because they bring up why nothing can happen. You need the despair in order to understand the opportunity. And you can manage them better, because if they can move to lift their heads up, it can really become a very powerful thing.
Okay, thank you. Lynn, first mic here.
Hello, my name is Mary Garvin Sapri, and I'm from Chamberlain College of Nursing in Atlanta. We're a new program, and we're very excited about getting our program off to a great start. I have humble beginnings in nursing because I started out at Clara Barton High School in Brooklyn, New York, where I, at the age of 18, had the courage to practice as an LPN. I will soon, I guess people don't always tell their age, but I'll soon be 50, and I'm excited that I have been a life learner, and I am working on my PhD. And I also would just like to thank Dr. Beverly Malone for being so inspiring to me over the years. And a personal thank you to Amy today, because throughout my career, I've had to care for elderly. I began my career caring for my parents, so I'm really grateful to hear that she is doing such great things to improve the care of elderly individuals. The other thing that I'd like to talk about, or to ask the question, is what kinds of programs can we create that will bridge integrative practices or put it this way, non-conventional therapies with conventional therapies to better address the chronic needs of individuals. I think our healthcare system has done an extraordinary job in terms of addressing acute care problems. But there is significant data to show that other therapies work, and not everyone is eligible or meet the criteria for just traditional care. So how can we as nurses begin to develop a program or programs using advanced practice nurses, nurse practitioners? I was educated as a clinical nurse specialist, so I'd say that I see both of those programs branching out into bridging both kinds of care to systematically deal with chronic illness in a better way. We see that Americans and people in other places spend millions of dollars on this care, and there is data to support that some of it actually works. So I'd like for you to address that. Thank you.
Kathy? Bev?
Well, the fact that to me, integrative care as a concept is still relatively new in most of America, except the corporate world. Patients still don't know what that means, so we have a lot of educating to do with our students as well as the patients. And I think those systems differ across the country. So the integrative piece is going to be unique to each community and each state, and in some cases when corporations are involved, within regions and totally in the nation. So that's to say it's complex. That's what I'm trying to say. And I think wherever one is, that it would be important to be sure that students understood that, and also understood, and you're right, that there is data to support not only traditional medical care or care that we have known as addressing acute and chronic needs, but also these complementary and alternative therapies. And there is a bundle of knowledge out there supporting it. But it's addressing that, and I think I've heard many nursing programs incorporating that in what they do. But for those who haven't, I sure hope you do introduce that to the students, particularly in pre-licensure. I know the curriculum is crowded, and I just would remind us that we have a bigger job to take care of the nation's health and teach beyond our entry-level licensure exam for these students. They must have that. So I give that in sort of vague ways, but to say I think it's important, I think we need to do it, and it's going to differ across the country. Thank you.
Yeah, I would just add to Kathy's comment in total agreement. Your point about it being evidence-based is so important, and there is evidence now. So as educators, accessing resources that are available, reliable resources that we can begin to integrate into the curricula across from the very beginning to the end to bring those complementary therapies in place. As we know, it's very difficult to practice safely if we're not including alternative complementary therapies in questions that we're asking in our assessments of our clients. I think that there's resources out there that are evidence-based that you can feel very comfortable about including in your curricula.
Thank you.
Thank you very much.
Mm-hmm. Let's see.
The guy at the back.
Second.
Good morning.
Yes.
I'm Joe Twitchell, president of the National Student Nursing Association.
Joe.
We continue to hear about the dilemma that new graduates are unable to obtain entry-level RN positions. What recommendation do nursing programs and the NLN have to address this issue?
Okay.
Well, you know that, Joe, the NLN and the National Student Nurses Association put together really a flyer that's on both of our websites that sort of gives some information about how students can address this issue. And it includes everything from understanding the context, the environment that we're living in right now, to the fact that you may not get that job that you you thought you really could not do without, that you wanted to be in critical care, you wanted to be in the emergent, that may not be the place you put your foot in the door. Getting your foot in the door is the major issue. And I know that someone like you, for example, I know that you did an internship in a hospital and worked in a rural area where you were everything. I remember you saying you even drove the ambulance. I love that issue, you know? That's pretty broad care. And we have to start where we are. And I think that's a different way of thinking for our nurses, our nurse graduates, but I think that's what we have to help them with. And of course, if we're going to get our students thinking like that, we have to get our faculty thinking like that too. And I did mention, and I do believe that care in unusual places for us. Why not provide care in older adult care homes? Why not provide care in prison systems? Should we not start in the community more and not necessarily in hospital? So those are all strategies for living in today's environment, but I believe it could lead us to even better delivery of quality care.
Thank you. Yes, please, first microphone.
Good morning, distinguished panel, and I thank you for this opportunity to speak. My name is Cheryl Williams, and I'm an assistant professor at La Brea College. We are an associate degree program in Boston, Dorchester, inner city Boston. I'm also a student, a graduate postmaster's student at Simmons College in their health professions education degree program. So I'm happy to be here today. One of the things I'd like to address is primarily a comment, and then just share a vision with me, is that we don't look around at our immediate larger healthcare organizations, and I see great merit in nursing faculty making liaisons with our healthcare organizations. For instance, our college was recently, we have a new owner now, it's Stewart Healthcare. And Stewart Healthcare has been very helpful with us in hiring our graduates, but encouraging that they get a baccalaureate within 5 years. So I see great merit in nursing faculty looking around locally at these large healthcare organizations that have a lot of money and a lot of power, and meeting with their CNOs and asking, what is it that you would like our nursing graduates to do? You say we don't provide nurses that think. Well, what would you like us to do? And design curricula to help meet their needs. And you know, if we just dare to dream, maybe we would just define nursing in a different way. For instance, you talk about postgraduate, post-baccalaureate education. Well, I see great merit as nurses with focus in government. Why aren't we teaching more government in post-baccalaureate education? I would like to have more of a focus on that. Yesterday I attended a lovely conference put on by some nurses for concept-based curricula. I learned that obstetrical nurses can teach fluid and electrolytes. Well, why can't we teach finances as part of post-baccalaureate education? So that nurses then are armed with a repertoire of government and finances that then they can go and write their senators and representatives really good letters that are not just carbon copies off of websites from lovely organizations such as yourself. They'd say, wow, this person actually wrote this letter. So these are the kinds of things that I see. And as nurses move away from the bedside and become more politically aware and become more of financial basis, we need to support that. Those are nurses. Those are nurses in Washington, and those are nurses that are running businesses. And we need to come together and recognize that they are nurses working for all of us. So those are just my comments.
Okay. Thank you for your comments, Cheryl. Those are very important. And what I'm hearing in your comments, you know, when Dr. Shalala was here, she talked very much about being advocates and understanding health policy. And so your points about including that in our curricula, undergraduate all the way through to advanced practice, are very, very important. The other piece that you brought up that I know we realize is important is that partnership between academic and practice partners, that we have to work together to keep those linkages alive, to identify the competencies that we need in our graduates. So your points are very well taken, and thank you for bringing them forward. I know we're getting a little bit close. We can probably take a couple more quick comments. And so who is next? Number 2?
Good morning.
Rumay.
I'm Rumay Alexander, and I am clinical professor and director of the Office of Multicultural Affairs at the University of North Carolina, Chapel Hill, and a Board of Governors member. I want to encourage us to be real about the organizational culture, the way we think, and the decisions we make, because culture will eat strategy for lunch every day. Given that, we know a couple of things. One, in many instances, people are using testing in a very punitive and non-formative way, and that's one of the issues that continues to be addressed as we move forward. We know that there is a lot of divisiveness between tenure-track faculty and the clinical faculty. We know there are lots of stereotypes operating about the partnerships between those who are our colleagues and partners in practice, hospitals, nursing homes, et cetera, and those of us on the academic side. We still have some serious issues with what we believe each of us has or does not have at the table. And so, not to mention the issues around cultural sensitivity and the fact that we talk a lot about how culturally sensitive and competent and how much we teach it, and yet just saying it doesn't make it so. So my question is, what ideas do you have regarding how to be very honest and real about some of the issues related to the organizational culture that get in the way or become a barrier to the direction we're trying to go in, and or ideas that the league might address in this area?
I think we should hire you as a consultant.
You got me on the Board of Governors.
And I was really thinking about the school's need, and I didn't mean you, just you, Rumay, but I'm thinking that it's very difficult for a school to do all of that work internally without some guidance and some help in that. So if they don't have someone who's able to look at that system in that way, they need to bring someone in to help them look at that system and understand it. So I meant you multiplied and many times.
Thank you, Rumay. And we'll take the person at the first microphone. That will be our last one today.
Hello, my name is Darlene Del Prado, and I'm from the State University of New York, Institute of Technology. I'm the chair of the Department of Nursing and Health Professions there. And our students are upper division RN to BS and also masters. But I've also taught in AD education for 17 years, and I'm very proud of that, so I think I have a broad perspective. This morning, Bev spoke about transforming nursing education and the importance of basing our decisions as educators and leaders on the evidence. So my question is, given the growing body of evidence on the effect of academic incivility on our students' professional formation and ultimately the negative effects of that carry over into the workplace and manifest as horizontal violence, which ultimately affects retention and the nursing shortage and all of that.
Okay.
My question is, what plans does the NLN have for addressing this, what I see as a critically important issue for us today?
Thank you.
I'll be happy to start. We have core values that we live: caring, integrity, diversity, excellence. All of that is about exactly what you're talking about. It's about civility. I mean, caring is, wouldn't you think caring would be civil? But we're not talking about caring from the position of being a provider and a patient. We're also talking about caring being from one to the other. And that is civility. That is the way to go about it. So this is something that you can't just put as a core value. You have to live it day to day, and that's one of the things we're doing. We put it into everything we do as an organization, and we're spreading the word. And so part of our mission is to get it out about the caring, about integrity. And interestingly, 3 of our core values were the same as for Enron. The only one they didn't have was caring, and we know what happened to the smartest guys in the room. So it's not just about saying it or having it on a piece of paper. It really is about holding each other accountable for that. And you have to find ways to hold one another accountable. And I think that we do in terms of our evaluations, in terms of when we are making presentations around the country, and we ask each other, are we living our core values? So I think it's about living the civil experience, not just saying it.
I would add to that there are 2 publications that have just recently come out that NLN's membership has spent quite a bit of time developing. And both of them get into those areas that you're talking about. One involves what we originally were going to call a code of ethics for nursing faculty. And that is to use not only individually, but as one interfaces with students in nursing education settings. And instead that changed into something we called ethical guidelines. And those have just been completed. And I would really encourage you to take those back, distribute them to all of your faculty, and start conversations about them. I think it will help move things forward. Another that we're working on and just about finished up will be presented tomorrow, I believe. And this gets back to the high-stakes testing that we've talked about earlier. But there are fair practices on high-stakes testing. We've developed that. The preliminary document will be distributed at that meeting tomorrow, but we expect to do even more on that within this next year. It's taken 3 years to pull that together. So we are paying attention to those items in a very, very serious manner. Thank you.
Thank you. I believe I see my Dean Marion at the...
They told me to come back up. Thank you.
Okay, I'm sorry.
Marion Broom, Indiana University. Thank you for this opportunity to have this dialogue. I'd like to speak to post-baccalaureate education for just a minute.
Thank you.
I think we have all in the profession and the national conversation really tried to focus on inspiring new graduates to continue their education. And one of the things I've become increasingly concerned about is, and through both personal experience with our NPSN students in our own institution, we only have a master's, postmaster's DNP. I am beginning to think that we have not spent the time that we need to spend on understanding how a postmaster's graduate learns to be an advanced practice nurse. We have spent a lot of time thinking about a novice to expert. We've had years of expertise in that. But we, as far as I know, there's not been a systematic approach to looking at when one gets their master's and then moves out into the workforce, how does one learn to be in actual practice? And yet we're moving on to these other advanced degrees, one right after the other, and I'm beginning to be concerned that we've kind of moved ahead without, and that's going to work for some people in some workplaces, but it's not going to work for a lot of them. And I just would like to encourage NLN to do that exploration, that systematic inquiry that will help us to understand more about that before we continue to rush onto post-baccalaureate DNP and post-baccalaureate PhD, although some of us are in the midst of that, obviously. Thanks.
Okay, thank you. Thank you very much. Anybody? Okay, great. Well, thank you so much for this very stimulating discussion. We are excited about NLN's role as a change agent in nursing education, and we look forward to continuing to work together with all of you to promote excellence in nursing education. I know there are lingering issues out there, and not everybody had a chance to have an opportunity at the mic to raise questions or comments. So please remember you have another opportunity tomorrow at the town hall meeting, which will be held here, 11:15 to 12 noon in this room at the NLN annual business meeting. So please continue to bring your comments forward. Just another announcement. Please don't forget that the Deborah Spunt Lecture will be held tomorrow morning from 8:30 to 9:30. This year, the past 4 Deborah Spunt lecturers will be together in a panel here on stage to update you about emerging trends in the use of simulation. You certainly do not want to miss their insights, and we want to thank Laerdal Medical for sponsoring this event. And now it is my pleasure to welcome Kathy back to the podium to deliver the President's valedictory address. As President of the NLN, Kathy leads with vision, integrity, innovation, and many new strategic initiatives are unfolding at the NLN as a result of her stellar leadership. Kathy, we thank you for everything that you've done for the League and the nursing community. Please join me.
Thank you. When you're inaugurated, you take a deep breath, and that's the last time you have a deep breath. So I'm taking another deep breath. The last 2 monumental years have been pivotal for nursing and for the National League for Nursing. Accomplishments for the public rippled through healthcare and in the United States. It will never be the same. Nursing's voice was loud and clear, along with the public outcry for better, safer care. Those who watched the winds knew the weather was changing. A confluence of events has unleashed a powerful, unstoppable force. In my opinion, the best parts of nursing's heritage have reemerged and strengthened. The nursing workforce at 3.2 million strong became the venue to accomplish what other disciplines working in silos have been unable to do. Nurses are engaged in public health, in nursing education, in specialty nursing, and in nursing research. Our colleagues are diverse. Just look at this audience and the International Council of Nurses' newly formed education network, now the largest ICN network at over 800 members and over 80 countries represented. The catalyst for nursing's reemergence as a force to be reckoned with began about 15 years ago. All of us remember the shame of the IOM's landmark report, To Err is Human, which identified more than 95,000 deaths annually due to medical errors. Despite a new emphasis on quality and safety, the picture had not improved over a decade later in 2010. Folks, during the last decade, more than 1 million people died needlessly due to our flawed healthcare system. That is frightening. Surely this equals a tsunami coupled with a couple of earthquakes. The new IOM report, upon which we are building, is the future of nursing. I know that there are those of us in our nursing numbers who reacted to what, on the surface, appeared to be physicians telling us what to do again. But the Institute of Medicine is not a physicians group. The organization is a private, sanctioned group to provide advisory reports to Congress and other players. Nothing that is contained in their reports is undocumented. And yes, nurses were involved in the report's formulation, particularly in the meetings held around the country. The NLN was there with its members, especially at the nursing education focused meeting in Houston. And I was pleased to represent the NLN at that meeting, and our CEO was a reviewer of the final document. As the oldest U.S. nursing organization, today's NLN stands on the shoulders of its leaders. During these last 2 years, we stood against forces that did not always embrace nursing education. We are still living with some of the serious mistakes of the past within our profession. I believe one of the largest and almost fatal mistakes was the removal of nursing education preparation from our graduate programs. Thank you. I believe that. And we stopped developing the science of nursing education. I believe that the science of nursing education must be part of nursing's research focus. The NLN has kept the nurse educator voice active, and the science of nursing education will remain a major focus. The NLN has stood tall when it was unpopular to do so. We have become a voice for the vulnerable and disenfranchised, and for those who desire good health and healthy living in a quality way through our students and our graduates. The NLN model of outcomes and competencies speaks to society's heart. When we embrace outcomes of human flourishing, integrity, caring, we set our goals against the grain. We become leaders for quality preparation of our nurse educators through national certification. Certified nurse educators are now over 2,600 strong. With input from the members, constituent leagues, and across the nursing community, we address issues such as high-stakes testing and competencies and outcomes. And all of the important areas of academic progression, the League champions post-baccalaureate education, not only in its master's preparation, but through nursing programs throughout the academic spectrum. We honor the many ways nurses enter into their career, LPN through doctorate. And as you know, the NLN lauds nurse educators in many ways of recognition, including the Academy of Nursing Education and our Centers of Excellence. Our Board of Governors and other NLN leaders and staff just completed a new membership engagement structure, which will transition through this next year under the leadership of Drs. Halstead and Malone. The nursing education research agenda of the NLN has been created for the future, again building on the foresight of prior leaders. As nurse educators, we know that access to our profession is funneled through a lengthy process called graduation testing and licensure. But we know that the licensure reflects minimum expectations, and that the real work of the nurse professional is just starting. That's why we prepare graduates for lifelong learning and competency development. We know there is a complex world of work containing an explosion of information, a morphing employment setting, and care that is bound, unfortunately, to the ability to pay. As nurses, our graduates must excel at critical thinking, accompanied by critical actions. Earlier today, you heard Dr. Malone speak of 9/11. Our own NLN staff was there that day, and some watched the planes fly by our windows. I can't fathom what that day and its painful aftermath was like. Like a phoenix, though, the NLN has risen from its ashes. We are in a much healthier place. We know what it takes, and it takes daring, grit, and leadership to move forward with hope. We learned that some traditions are worth keeping and that others should be altered if the only reason they exist is to fit our worldview or to maintain our comfort. Leaders can be all loud and wrong, and they do not necessarily operate from a moral center. This does not happen in today's NLN. Building on the work of those who came before and benefiting from a stellar CEO, staff, membership, and board, the NLN has regained its position of leadership. With courage, we have displayed the leadership necessary to shape the future needed by our country. The NLN values of caring, integrity, diversity, and excellence have become our compass. We know that no one organization or leader can do it all. A team approach with arms linked is necessary at all levels to change healthcare in the U.S. and abroad. The last 2 years have been historic for nursing and nursing education, and history continues to be made. The future can be even more memorable. We are under tremendous pressure to produce nurses or risk more of nursing being carved out to other disciplines. There are new ways of educating that lead to excellence. We know that an organization can lose its way without a value-based mission. We know that we must embrace our link to practice. These have been 2 eventful years creating the dominance of U.S. nursing education. I offer a caution, though, to not become lost in the invention of the buzz phrase of health sciences. The nursing identity of our programs must be maintained by our universities and in our organizations, also in our efforts and where our graduates are prepared. Nursing education has again arrived via the NLN to improve and shape the health of all. I started my presidency by introducing my family to you, and I want to end that way. Sorry. I want to ask my husband of 28 years to come stand up here with me on stage. We also have several of our children who've been here, and one who's here in the front row and won't come up, and she's a nurse educator in Georgia and a doctoral student in California. I have learned that one can't lead well as a volunteer without one's loved ones who are also volunteering to miss family time together. Sam has been beside me, caretaking and supporting for these 4 years. He even fed me fruit at the break because I couldn't get away. But I ask you to thank him for what he has given me and ultimately you. Stay here. Yep, stay right here. Okay. I anticipate that even greater achievements will occur through our 35,000 members and our relocation to Washington, D.C. We have challenges ahead, but we're prepared to meet these head on. It has been quite the ride. In summary, always remember that with your help, the NLN will continue to lead during such a time as this. Thank you for that opportunity. We have some pictures to get. If you'll hold them just a minute, we've got a few pictures to get, please.
Once again, let's thank Kathy for everything she has done and will continue to do for the NLN. Thank you, everyone, for coming today, and enjoy the rest of your day. Thank you very much.